It's 5 o'clock now, so we're gonna get this going. For those who don't know, I'm Dr. Richard Kim, and welcome to my December webinar. And we'll be going over some basic information about stem cells, regenerative medicine, knee pain, back pain, these sorts of things, and then hopefully address some questions that people have had. We are going to give me a second here and switch over to my uh, presentation. Uh, two major things to get started with. If your volume is not up, turn your volume up. That certainly helps hearing what I have to say. And number two, in the middle at the bottom, there should be a Q&A button, and you can always push on that and ask a question. Feel free to ask a question at any point in time, but most likely I'll be answering the questions at the end of the uh, um, um, at the end of the webinar here. Okay, so let's get started. See. So we want to know exactly how stem cells solve pain. And that's why we're here. That's why we're paying attention to this and listening to this. The first question comes from Joe C. From area code 518, and his question is simple. How do you cure back pain? So for us, it's important to know what you mean by back pain. Does that mean arthritis? Does that mean stenosis? Does that mean degenerative disc disease? We want to understand what these terms mean. And next, we're going to talk a little bit about how regenerative medicine works, and specifically for back pain as well as other sorts of pain that you have. The second question comes from Gail M. from area code 514. Simply says degenerative disc disease and scoliosis. And the answer to you, Gail, is yes. But our methods are non-surgical. We're talking about something that does not require medication. We all have common goals, don't we? Even I, as not just a physician, but as a patient, sometimes on the other side of the table, I want to avoid surgery. I want to stop medications. And lastly, I want something that's going to help me with my quality of life, especially if my quality of life has been suffering. We want something with common goals. We all want very similar things. What do we want? We typically want a plan. We want somebody who has an understanding of where our goal is and then therefore how to get it. Number two, we want the plan to be safe. We want low risk. We want short recovery. We want to avoid pitfalls. And these are pretty typical as patients. We want to get the sort of biggest bang for our buck, or in other words, get the most amount of benefit with the least amount of risk. Let me give you a couple examples here. The first one is about a retired psychologist that became our patient. Flew airplanes for a hobby, was a runner, ran competitively, but also was a major source of stress relief, as well as flying the airplanes. But the back pain ended his running career. That meant no more competition. The fun ended. The stress relief was gone. This also limited his flying time. He could go up 45 minutes later. Airplane had to be brought down. Couldn't handle beyond that. The second is a chef who enjoyed spending time with his family, but was in constant motion, moving heavy restaurant equipment. This was starting to affect his work. The back pain was making the work days difficult, contemplating changing careers. Obviously, a pretty big impact here. In general, our traditional treatments were very limited. Number one, we had surgery, which we all understand to be permanent. It's quite invasive, and often associated with long recoveries. The second issue was medications. And these typically fall under one of two options. Number one, you had steroids, which are typically a Band-Aid. But steroids weaken and damage tissue. That means if you take repeat steroid doses, you're talking about repeat weakening and repeat damage. Obviously, not a great option. The other option was over-the-counter medications, which were, there to help lessen the symptoms, but the effect wears off, and then you have to eventually repeat the dose. 2 months after stem cell therapy in both patients, the psychologist returned to running, ran the 4th of July race that we have here in town, and was able to complete the 4 mile race at a 13-minute pace, not his favorite, but he got to finish the race, which was important. This actually gave him enough confidence to train for a half marathon with his grandson, which was huge. Lastly, was a chef. The chef was able to go back to work full time, provide for his family, continue doing the job that he enjoyed. The big thing is this, that we often have this cycle and we want to break this cycle. It's between pain and degeneration. You feel pain, you end up with degeneration, you develop degeneration, it develops more pain, and on and on and on. But we're really the third solution, not surgery, not medications. And what we do comes with a fairly high success rate. One of the great things about what we do is the years of relief that you can get from the types of therapies we do. And we're talking about something that has a guaranteed acceptance. It's cells that come from your body, go back into your body. So that's a pretty important phenomenon. What exactly is regenerative medicine? It's a very, very new field. When I say new field, it's been around for a few decades, but when you compare it to antibiotics or infectious disease, those sorts of fields of medicine have been around, far, far longer. The goal here really is to restore but not replace the tissue. So not trying to replace with metal and plastic, but restore what you originally were born with, technically. We want to take that damaged tissue and turn it into a healthy, functional tissue. That means using different materials used to restore this health, including platelet-rich plasma and stem cells. Well, what's the difference between the two? Well, not only do we obtain them from different areas, but platelet-rich plasma is really for the green and yellow circle there. So let's just say small to medium-sized problems. And then the stem cells are really for the yellow and red, which sort of stands for the moderate to severe. Red is bad, green is good. So in this video clip here, you can see where the red is a damaged area of tissue and the green is therefore attacking it. Where red represents pain, stiffness, sciatica, nerve pain, neuropathy, numbness, aching, grabbing pains. The green are the stem cells, and that's how we go about attacking the damaged area. Another good example that I like to often bring up is the Pac-Man problem, where the pellets are the little bits of inflammation in your Pac-Man. Therefore, eating one pellet at a time is something like platelet-rich plasma. Now, you put multiple Pac-Man on the same screen at the same time, in the same maze, going through all the pellets at the same time. That's kind of more like stem cells. But the goal here, whether it's PRP or stem cells, is not to beat the level like we normally do in Pac-Man and then go on and play the next level. It's to beat the game. It's to leave the problem behind so that you don't have to play this chase the inflammation game again. And in fact, that's what we're doing. And we're talking about stretches of time that can be anywhere from 5 to 10 years. Where do the cells come from? During our process, they typically come from one of two locations. We're talking about the bone marrow or fat, and usually on the backside of this spinning pelvis here. And then we'll take that material, process it, and then inject it into places like the spinal cord or in the knee or in the hip. When you undergo this process with us, this is what our typical timeline looks like. And again, this may be different for other providers, but for us, it starts with the consultation. Pretty soon thereafter, once you've decided that this is what you want to do, we try to get your MRI for you, and we have our own MRI. So when we say try, meaning we schedule that in our office. We undergo a first round of PRP, followed by a stem cell and a second round of PRP, and then finally a third round of PRP. At the third round of PRP, that's when we're initiating things like physical therapy, chiropractic care, and exercise, and then getting you back to normal routine. So, what do we help? Can we treat? What are the things that we like to see in our office? Stenosis, arthritis, degenerative disc, sciatica, especially in the neck and back. This is some of the more typical things that we see. It's not limited to this, but these are the sort of most common, I'll say, that we see. When it comes to the lower body, we're talking about the lower body pain, such as more arthritis, and that goes to the hip, the knee, the ankle. Bursitis, meniscus damage, meniscus tears included, things like Achilles tendon or tendon damage, long-term tendonitis or tendinopathies. What about in the upper body? Absolutely. So rotator cuff, shoulder arthritis, tennis elbow, and even things like carpal tunnel down in the wrist and hand. Everybody is curious, though. Am I a candidate? Is this something that can apply to me? The way we like to think about it is that basically, if it's something that can be injected or operated on, yes, then stem cell is also amenable to that area. What's important to us is having a diagnosis. If we have an accurate diagnosis, then we have an accurate location, which in turn means that we have the ability to offer you an accurate therapy. And just as a reminder, all our therapies include the MRI as part of the process because that helps with the location and accuracy. What if you've had surgery? The answer is yes. So even if you've had it, a surgery, even if one was done in the past, in a lot of cases, still possible. So the most important next step after that is undergoing a consultation. So we can examine you, we can undergo, evaluation of your history, look at your diagnosis, see any images that you have. In part of that, we're going to want to know what kind of surgery was it? Was it an arthroscopy? Was it a fusion? Did you have rotator cuff surgery? How long ago? Did that fail? These sorts of pieces of information are important. Here's some frequently asked questions that we typically get, and then we'll go into the ones that everybody's asked. Number one is, where will my stem cells come from? So again, going back to where we talked about coming from either bone marrow or coming from fat. In no circumstances and until the foreseeable future do we ever take stem cells that come from a laboratory, come from a different person, come from an animal. These are not allowed by the regulations that govern stem cells here in the States. And so therefore, not something we're interested in or even able to provide. Well, how long before I can become active? So if you remember the timing sequence for us, getting through all three rounds of the PRP plus stem cells is when you become active. When do you start to feel the benefits? I would say before the third injection is a typical time frame to start feeling the benefits. But again, if you remember my graph about how people get better, it's not an overnight thing. It is something that just steadily gets better week after week, month after month. Question of how long will the tissue stay repaired? So different parts of the body, different lengths, but I would say anywhere from 5 to 10 years. And having had done this for 10 years now, I can tell you that that's the not just the what the research and the evidence supports, but that's been the experience in our office. Lastly, how well does this work? And this is truly individualized. So even though I'd like to give everybody a firm number, to person, it's a small amount of variation. Surgery matters. There's a couple other factors that matter, so that those sort of things can influence. So certainly something when we evaluate you and we see you in consultation, we can give you a better idea about. Let's see. So Jason D from area code 518 said, well, I've got some questions about degenerative disc and herniated discs. So my favorite analogy here is the uh, jelly donut idea. If your disc is a jelly donut, there's a soft center, much like the jelly of a jelly donut. When the jelly leaves the donut slowly, we call that degenerative disc disease. But when the jelly bursts through the donut and leaves suddenly, that's a herniation. And for those who've undergone or had the misfortune of feeling a herniation, you know, one day, one moment, jelly in the donut, next moment, jelly out of the donut, and you know it. So the timing of that, the slow deterioration versus that sudden pop and change, um, is the difference there. What we also know is that if you look inside the large circle there, that if blue is the disk, you could see the close relationship to the nerve. Therefore, when jelly leaves the donut, you are now creating stenosis. You're creating inflammation that can affect the nerves that are meant to exit the spinal cord. In our case, for you, Jason, stem cells really mean keeping jelly within the donut. And we don't want that leak. We don't want that sudden pop out. We want to keep that inside as much as possible. And that makes sense. If we can keep the jelly in the donut, we can offer you a more functional, a healthier disc that would cause both less pain and allow you to do more things. Peter A. from 315 said, my girlfriend and I will be attending. She's looking for extended relief from lower back pain from herniated disc in the L1, L2 area. Been a long time issue for her, and she is not interested in any surgery. So, Peter, I can completely understand our entire practice is built around people with the exact same thought process. You hear about these surgeries, don't go well. People end up with more problems afterwards, only to have more surgery down the line, and then, of course, then one thing after another, and people just getting worse and worse. And I can tell you from what we do, you've heard already what I've said. We're non-surgical. We are non-surgical till the cows come home. We do all our procedures in office. So there isn't a hospital involved. There isn't a general anesthesia involved. And our therapies last 6 to 10 years, which is an important thing to note. Because this isn't something that you have to repeat every 3 months. You don't have to repeat this every 6 months. We're talking about years and years of relief. For us, an L1, L2 is a pretty common area of therapy, but we're really not limited to just the low back. We're able to treat anywhere from the neck, which is the cervical spine, the thoracic, which is the mid spine, and then the lumbar, which is the lower spine. Michelle M. asked from 585, just how the procedure works. How do I know if I'm a candidate and the approximate cost? So for you, Michelle, a couple of questions we want to know first, right? What's the diagnosis? What is it that you have? What is your physical ailment? What are we helping? Because that can you know, change how, or it'll give us an idea of then what sort of therapy works best for you. Same when it comes to severity. Are you a green circle or are you a red circle in terms of severity of problem? Do you need just PRP or do you need PRP plus plus the stem cells? And obviously, this is something we'll go over with you during the consultation. How exactly this works, excuse me, is that what we're applying is a cellular therapy. We are not using screws, metal bars, plates. We're not inserting anything into your body that's foreign. What we're putting into your body is only stuff that we ever took out of you. So what we're utilizing is almost this very whole therapy where it comes from you, it gets processed and then injected back into you. And believe it or not, this is the the magic, the secret, or however you want to describe it, in that there isn't really. There's that we in our own bodies have the capacity to heal things. It's just that sometimes those cells that do the repairs don't exist immediately where the damage is. Well, that's where I come in. That's where my office comes in. We help put those cells in that place. So again, not surgery, not medication, therapy lasting years. Kirsten E. from area code 315. Degenerative disc disease and stem cell therapies to help. I have a spinal fusion and am now disabled due to my conditions and arachnoiditis from my fusion. Kirsten, I'm sorry to hear that. And we know that now we know, I guess, that when we undergo these surgeries like these fusions, they lead to something called adjacent segmental disease. That means in this picture here, you can see where the screws and the metal bars went in. Well, the disc immediately above that and the disc immediately below those two levels are now going to have to become more flexible because you just lost the flexibility in this area that you've drilled into. And unfortunately, for a long time, that was the quote unquote best thing that we had. Fusion, meaning permanent loss of flexion, disc above and below to force to compensate. What that really ultimately leads to is now a increased speed of degeneration of those two discs. So while you tell me you're now disabled, sadly, unfortunately, on some level, I'm also not surprised because this is what happens sometimes after these types of surgeries. But I can say that we have treated many, many people with adjacent segmental disease very successfully and helped them reduce a great deal of pain and improve the quality of their life. Anne Marie H. from area code 518 says mechanism of action. So a little broader a question. Um, Anne Marie, the way we really like to think about this is that we are a biologic strategy versus if you look at a surgical strategy, you're either cutting something out or putting something in. That isn't the goal here with us. The goal here with us is return you back to normal. You've started to degenerate. Can we put in cells? Can we put in stem cells? Can we put in platelet-rich plasma that then returns you back to your original state? And that's really what we've been proving over the last 10 years in our office, time and time again. And so it's a very, very different strategy. It's not what you'll typically hear from going to the surgeon or, and maybe even from your primary care, because unfortunately, not a lot of people understand or know this kind of medicine. What we like to think about too is that by adding these cells, we're creating an environmental change, meaning that disc, the environment of the disc is changing. Or if we're treating a knee or a hip, the environment of that knee joint or hip joint is changing. We want to change the biology and not just make you feel better, not just do a symptomatic control, which is unfortunately what we get out of steroids and cortisone. And even when we do that, you know how temporary those strategies can be. So very, very different here. Alan A said, where are the stem cells harvested? Are they pluripotent? So great question. So Alan, all of our stem cells are always autologous versus what we call allograft. Our stem cells come from you back into you. Allograft means that they come from somebody else and then into you. So in this country, unfortunately, allograft is out of the question, except for things like leukemia therapies and some of the cancer therapies in what we call musculoskeletal or orthopedic type complaints. These are not allowed. Pluripotency, these are not pluripotent. Pluripotent, we're thinking more of more embryonic type stem cells. This is what we call multipotent stem cells because they've already undergone a few differentiations, but plenty of strength, plenty of potency in them. Again, and we have 10 years worth of patients to prove that. A lot of this, this may be interesting or not interesting to people due to FDA regulations. FDA doesn't have an approval process for this, but they do have regulations, meaning if you are going to provide these sorts of services and therapies, you must follow these guidelines. It doesn't therefore make you approved or disapproved. It is just simply guidelines for us in the medical community to follow so that, we're not harming people. Marianne C has two questions here. First question was, and she's from area code 623. Learn more about stem cell research, how that's better than taking pain injections or having surgery. And again, we were talking about it before, but pain injections really are temporizing. They're a very temporary, short-term fix. Even things like ablations, the nerves grow back and then the pain comes back, and then you've got to go back in again every 3 months, 6 months, or however the frequency is. Steroids, sometimes even worse. And the other thing about surgery is that it's irreversible. Once you get the toothpaste out of the tube, there's no coming back from that. And really, until stem cell therapies have become more prevalent, more of a widespread option, we really didn't have many options between that pain injection and surgery. So it's almost like I should put this line above surgery. So instead of going from pain injections and then straight to surgery, that's really where stem cells come in. And for some of those who don't even want pain injections, yes, you can skip that. You don't have to undergo the pain injections to sort of qualify for this. Marianne also asks solution to my chronic back and hip pain. So imagine if you've thought about injections or surgery, you probably feel like you have some fairly limited options. But back and hip pain is exactly what we do. We're talking about effects that last anywhere from 6 to 10 years, and in other places I said 5 to 10 years, but somewhere around that time frame. All outpatient. We do this in our office. You walk in, you get it done, you walk out, you drive home, etc. So recovery from home. So we try to make it as seamless or as easy as possible. Linda A said from 208, can you help bone-on-bone knees from osteoarthritis? Yes, even bone-on-bone arthritis. We just saw an 80-year-old individual yesterday, I believe, who came in to us with bone-on-bone arthritis, felt like her knee was starting to bow, and we were able to help her and have her return to walking and getting back to activity and some quality of life. Certainly for you, Linda, I certainly urge consultation. If you have imaging, great. If not, that's okay. If you've had been told that you have bone on bone, we pretty much know where the next steps will be with you. Chris from Mary Code 315. Okay, so this is a little longer one. Can stem cell therapy work when you have 30-degree lumbar scoliosis plus degenerative disc disease, arthritis, facet joint disease, spondylolisthesis? Already using a spinal cord stimulator since June of 23. First had lumbar decompression surgery with facetectomy, disc decompression in July of 2017. February 24 went for a second surgical consult in Rochester after my surgeon wanted to do spinal fusion from T10 down. Yikes. The second surgical consult said no one should ever do surgery on me. It would be a 9-hour surgery with too many complications, that the risk was far too great. I was told to live with this pain for the rest of my life using pain management. Been using pain management since February of 2018. My condition continues to worsen. Hmm. Chris, I can't tell you how many people we hear just like this, and it's a hard story to read, to listen to, and I can only imagine what it's like to be in your shoes. But I have pretty good confidence we can help you. Why? Because we've been there, we've seen these types of patients, we've seen patients like you before, and this does not daunt us. It doesn't scare us. It actually we feel pretty confident with people with this degree of arthritis. Believe it or not, one of our first stem cells had a greater than 30-degree scoliosis, and she's more than 6 years out, doing great, running around. She's a stand-up comic, funnier than all get out, and continuing to lead her life. So it was great. It's great to see. The best thing, and I say this repeatedly, is this is minimally invasive. Don't need a hospital. Don't need 9 hours. Don't need general anesthesia. You walk in, have this done, walk out. David S. from area code 518. Sorry, everybody, another long read here. What's a possible reason to experiencing leg pain between the back of the left knee and the hip joint nearly 24/7? Seems to be pain moves up and down in the back of the leg muscles only between the back and knee joint and the hip joint. I've had an EKG, I think maybe EMG is what you meant. Two x-rays, cardiovascular exams, but no doctor has yet found the cause or solution to end this problem. I live in Yorkville and am a young 98-year-old in quite good health. No meds or drugs or alcohol. I had one operation years ago for prostate cancer. Can you possibly help me? So your challenge here, David, is diagnosis. So before I even apply things like regenerative medicine, apply things like stem cells, or apply things like platelet-rich plasma, we need to first figure out what's going on with you. When we work on finding a precise diagnosis, then we can work on a precise treatment. And a precise treatment oftentimes means that we're having a successful treatment. So it really starts with that right first step. In listening to you, sciatic nerve is a possible issue, hamstring is a possible issue. It's a possibility with spine, even though your EMG and X-ray came back negative. Um, uh, it could still be one of these areas. Remember, no test is 100%. So I feel like we can help, or at the very least, have a good crack at trying to figure out the diagnosis. One of the things that me personally as a physician really like to do and work on is finding those tough cases, the ones where other people couldn't figure out, other people couldn't make better. That certainly invigorates me and is a challenge for me. So I certainly welcome you to come on in and let me help you. Tracy S. from 315 says, does it help with spinal stenosis? Does insurance pay for this kind of treatment? So Tracy, this picture here between the background large picture and the blown up picture is where stenosis is. If you can imagine blue as the disc, and let's say that center purple is the jelly to the donut, you can sort of see when that disc material pushes backwards, it pushes back into that yellow, those yellow canals or those yellow fibers or those yellow structures. And that's your nerves. So when you push into that region, you're creating stenosis. And so therefore, if you can treat the disc, help the disc be more functional, less irritated, less inflamed, you can absolutely help stenosis. And in general, stenosis, you feel you have very limited treatment options. And again, surgery is not a great one for this. Obviously, if you have things like arthritis, you're talking about increasing pain. Going to one of the highlights of regenerative medicine once more is that, there's a high degree of benefit with, an absolute low risk. Insurance, unfortunately, is not something that covers these sorts of therapies. So as of now, unfortunately, it's still an out-of-pocket expense. Ronald P. from area code 518 would like to learn more about stem cell treatments, whether I'm a candidate, if it's likely that I could be helped, and what the process and cost would be. So stem cells for us are always autologous, and we're talking about taking them from bone marrow or adipose and fat. You talk about stem cells, but we in you, Ronald, we want to know what we're treating. That can change our treatment options drastically. So, what is the diagnosis? What are we treating, Ronald? I encourage you then to make a consultation, get that next step. Every person is a little different. Not all back pain in each person is the same. Treatments are different. Therapies are therefore different. The cost in the people are absolutely individualized, and so it all depends on what we discovered during our initial visit. Dennis MC from area code 514 said, I've had chronic back pain, especially in the mornings, and would like to know if regenerative medicine would help me. So Oftentimes, when we hear about chronic back pain that is irritated in the mornings, we're thinking about something like degenerative disc disease. When we lay on our back, a lot of the water in our body goes backwards, and that's, guess what? That's where your discs are, which tend to irritate the nerves and the back. You stand up, water drains to the feet, and then it gets better throughout the day. So it sounds suspicious for degenerative disc, but that's just from reading a single sentence that you sent to me. We would want to know, is there arthritis involved? Is there stenosis involved? Is there nerve involvement? How long has it been there? Have you had an MRI? So certainly for you, Dennis, a consultation, and we can explore all of that together. Andrea R. from 514 said, looking for information on treating degenerative disc, degenerative facet disease, stenosis due to psoriatic arthritis. So yes, so Andrea has a diagnosis, degenerative disc, facet disease, stenosis, on top of which she's got this autoimmune condition called psoriatic arthritis. So yes, to stenosis, facet, all things that we can treat. And yes, things that we can treat at the same time, just in case that's a question. If you can sort of see in the background here, the background picture shows a tunnel. I did that on purpose. So the tunnel exists in our spine at every level, and that tunnel is held open by the disc, and the nerve then runs through the tunnel. Except in people who have degenerating disc, who are developing facet disease, that tunnel is closing. And when that tunnel closes, it is therefore pinching on the nerve. And that's really where stem cells come in. It can really help hold that tunnel open. It can allow that nerve to function normally. If you start off with something like an autoimmune disease, psoriatic arthritis, rheumatoid arthritis, all of these, what we call arthropathies, it initially starts out as pain, but there is damage. There is damage to the joint. And when you develop damage, it then becomes what we know now known as osteoarthritis. So even if you have a psoriatic arthritis and you've had it for long enough, it's pretty good chance that you have this joint disease as well. And if you develop the joint disease, that's certainly where we can step in and make a difference. Becker, no last name. Area code 404, really bad knees. Help, need help. So again, we talked about this before. Even if you're bone on bone, and you feel that that's what you have, and that's where your knees are or your hips are, that typically means some level of arthritis. Pretty common diagnosis for us. Again, our three-step process is probably what we would apply in this case. And for us, MRI is included. So a consultation for you, Becker, would be helpful. Kathleen L. from 315 said back pain for over a year, 3 shots, tried PT, not a candidate for surgery, taking gabapentin, baclofen, nothing is working. Looking for alternatives. Very common story that walk into our office, Kathleen. And I feel confident that we can help. You've tried the conservative measures, right? You've tried the physical therapy, you've tried the injections, and nothing's taking hold. If you've had it more than a year, you are certainly what we would call a chronic back pain, not an acute back pain. And this is where we're kind of in the severity trap. If you look at the MRI, the surgeon may not think you're severe enough to do surgery, but certainly you feel like some other form of therapy needs to be done or tried because look, the PT, the medications, the injections haven't worked. So definitely for you, Kathleen, that's where stem cells sort of fit when you're not ever thinking about surgery or don't want surgery or want to avoid surgery, but really have tried a lot of the other things, such as injections. David K from 585 simply said back, neck pain issues. So if Dave, in your case, if you hear the words like degenerative disc, stenosis, arthritis, these are all the typical things that we treat. If you're working hard to try to avoid surgery, then certainly this is the kind of therapy for you. If what you experience in what you mean by issues is anywhere from sore to achy to sharp to shooting type pains, nerve type pains, etc. These are the sort of conditions. These are sort of the symptoms that people, our patients complain about, and we're able to help. Eric W. from 845 said information regarding stem cell for back pain. So get answers, consultation, getting an image. We have in-house MRIs, which can help you. Going to our webpage, richardkimmedicine.com, is something that is a place where you can find more information. I like this picture on the right, and I'll tell you because it sort of cuts away piece by piece. You can see in that sort of center blue lake with the sort of racetrack going around it, that's the jelly of the donut. In fact, that cartilage end plate where I've drawn that circle is how the disc typically gets nutrition. Doesn't have an artery, doesn't have blood vessels like your skin or your bones or your liver or your kidney would normally get nutrition. Because this fragile relationship of receiving nutrition through that cartilage end plate, this is why discs degenerate. And once they start to degenerate, it is hard to help them regenerate, except until you apply things like stem cells or platelet-rich plasma. And that can help recreate that connection, help recreate that avenue for health and for nutrition once more. AC from 914 said, is this helpful for long COVID treatment for treatment of inflammation, joint pain, brain fog, GI issues, and nausea? So great question. And we get people asking us about stem cells, knowing that we do it. Can you do it for this? Can you do it for that? So things like long COVID, unfortunately, not a great ton of information or evidence to help. The one thing I would say in all of this is the joint pain. So what we do it for is the MSK indications, the knee pain, the back pain, the hip pain. And so there may be a role there, but certainly a consultation with us will help us understand that. All right, so that was the end of the questions. Just to give you guys who have attended this webinar and stayed all the way through um, uh, some offering here. So if you've come to this webinar and you've attended it, I'm going to offer you a free consultation. The catch is you have to call Friday by noon. You have to mention the webinars, and you've got to schedule the consultation. Our phone number is 518-871-9900. And for those who live north of the border, it's 514-697-8919. You can learn more information at richardkimmedicine.com. You can see prior and future webinars at /webinars. You can schedule your own MRI at /MRI. Our next webinar will be on January 15th. So for any of those who are interested and so inclined, we'll be running this very, very similar format again. Okay, so I am going to escape out of this. And a good time for Q&As. We have one that is here already. So, question from Andrea, is this safe for issues caused by autoimmune diseases like psoriatic arthritis in the spine? So, absolutely, Andrea. We've treated those with autoimmune diseases numerous times. Spondyloarthropathies, we're talking about things like ankylosing spondylitis, rheumatoid arthritis, psoriatic arthritis, certainly treated many, many individuals with that. And utilizing these sorts of therapies for that is a great adjunct. If you're on a biologic, you can continue on the biologic. I certainly wouldn't come off of that. For those who are on chronic steroids, the steroids can affect the outcome a little bit, but that's certainly something we want to talk about during your consultation and talk about it a little bit further. So that's a great question, a kind of a unique one. But yeah, certainly have helped many people in that situation. So I'll wait for a few more questions, and then if no other questions, we'll shut it down. Okay. So it sounds like that's probably the, oh, here we go. Sorry, Eric. Eric says SPECT scan shows arthritis at T10-11. Doc T10 and 11. Doc wants to do a T9 through 12 fusion. Damage likely from past trauma, motorcycles, etc. Do you think you can help? I really do. So the thoracic spine is very technically difficult, I'll say. It isn't for your beginner type regenerative medicine physician. I have absolutely treated all of those levels that you just talked about, T9, T10, 11, 12, on down to the bottom. I've done up in the neck, all the way from the base of the skull all the way on down. So those areas for me, I don't find difficult. Those are pretty common areas for me to treat. We want to see the images. We'd like to talk a little bit about, what kind of symptoms you're having. Are you having those sort of radiating pains that wrap around to the front of your body? How much of it is nerve and how much of it is arthritis? But in terms of just the answer, yes or no, yeah, that we can help. I'm pretty comfortable with that. Andrea asked one more question. Can this help with compression fractures in the thoracic spine? The answer to that is yes and no. So when it comes to compression fractures, so let me just briefly explain in case anybody doesn't know. Compression fracture is when the height of the vertebral body gets sort of crushed. And sometimes, and a lot of times in folks, that you can get that from osteoporosis. Osteoporosis can happen from a variety of things. For somebody like you, I would wonder about how much steroids you've been on. Did that put you at increased risk? I don't want to know about age. How much do you weigh? These are the sort of factors about osteoporosis. In the acute phase of compression fracture, there is not much that stem cells can do for you. That means, within the first, let's say, 6 weeks to 8 weeks. However, if you get past that point and you continue to have this pain months after, we're talking about 3, 4 months later, and you say, look, I still have this pain. It's not getting any better. That sort of pain, yes, then we can help. The reason being that you saw my little pictograph of uh, bone, cartilage end plate, and disc. When you create a fracture, it ruins the relationship between the bone, the cartilage end plate, and the disc. So we see a lot of what we call discogenic pain, disc-based pain, long after people have developed compression fracture. So we've been in positions where we're just a few months out from the compression fracture. We've been in positions where we're years out from the compression fracture, and in both have been able to help. So that's a yes as well. Hopefully that helps. More questions? Eric got another one. Here we go. Eric says, also costovertebral junction. They want to trim back the rib. I will see you soon. Okay. Yeah, I mean, I wouldn't trim back the costovertebral junction because with the therapies I do, I can get into the costovertebral junction and inject that. It's not again, it's not for the beginner type regenerative medicine physician, but having done this for 10 years, those we do pretty regularly. So yeah, I feel pretty comfortable with that. Don't trim those back if that's what you're asking. Yeah. All right, you guys. I guess that's the extent of the questions. Hope to see you guys at some point in time. And if you have any more questions, feel free to give a shout.